Dr. Elena Vasquez had spent 15 years trying to forget the field hospitals, the impossible surgeries, and the soldiers she couldn't save in Afghanistan. Until a military transport crashed near her rural clinic, and she became the only surgeon within 100 miles who knew how to operate under fire. Welcome to Daily Story. Before we dive into this extraordinary tale of hidden expertise and life-saving decisions, tell us in the comments what city you're watching from today. And if you believe stories like these deserve to be told, hit that subscribe button to join our community. The Cedar Falls Medical Clinic sat at the intersection of two county roads in rural Montana, serving a community of 2,800 people scattered across 500 square miles of ranch land and grain fields. The single-story building had been constructed in 1987 with federal rural health funding, equipped to handle routine medical care, minor injuries, and the occasional emergency that couldn't wait for the 90-minute ambulance ride to Billings. Dr. Elena Vasquez had been the clinic's only physician for 15 years, providing primary care to ranchers, their families, and the handful of businesses that kept Cedar Falls functioning. At 48, she had the patient demeanor and practical appearance that marked her as a rural doctor, comfortable with everything from delivering babies to treating injured livestock, always available for emergencies, and trusted completely by a community that depended on her medical expertise. Her patients knew her as the doctor who made house calls during blizzards, who kept the clinic open during holidays, and who somehow always seemed to know exactly what was wrong before running any tests. She lived alone in a small house behind the clinic, maintained a vegetable garden, and had the kind of quiet routine that helped former military personnel adjust to civilian life. What her patients didn't know, what the community couldn't have guessed from her gentle bedside manner, was that Major Elena Vasquez, United States Army Medical Corps, had spent 12 years as a trauma surgeon in forward operating bases across Afghanistan and Iraq. She had performed over 800 combat surgeries, saved countless lives under impossible conditions, and developed techniques for battlefield medicine that were still being taught at military medical schools. The transition from combat medicine to rural practice had been part of a carefully planned psychological recovery. After 12 years of treating soldiers with injuries that would have been fatal in civilian hospitals, Elena had requested reassignment to work that preserved life without the constant presence of death. Rural medicine allowed her to use her surgical skills to help families rather than patch up warriors. Her small house was comfortable but spartanly furnished, with one room that served as a private study lined with medical journals and continuing education materials. To casual observers, it looked like the library of a dedicated rural physician. Hidden behind the civilian medical texts were military surgical manuals, trauma protocols, and field medicine guides that represented 12 years of learning to save lives under fire. Elena had found peace in the predictable rhythms of rural medical practice. Each day brought familiar challenges, managing chronic conditions for elderly patients, treating injuries from ranch work, and providing preventive care for families who often went years between medical visits. She served a community that trusted her completely, work that healed rather than treated the consequences of violence. The night of October 12th started like any other late shift at the clinic. Elena was completing paperwork from the day's appointments when her emergency pager activated at 11:43 p.m., a sound she hadn't heard in 3 months. The message was from County Dispatch: multi-vehicle accident, Highway 191, possible military aircraft involved. Elena grabbed her emergency medical bag and drove the 12 miles to the crash site, where she found a scene that transported her instantly back to Afghanistan. A military transport helicopter had gone down in a ranch pasture, its rotors scattered across 200 yards of grassland. County sheriff's deputies had established a perimeter, but the nearest ambulance was still 40 minutes away. "Doc, we've got 3 survivors," Sheriff Martinez called as Elena approached the wreckage. "All military personnel. 2 are conscious but injured, 1's in bad shape." Elena assessed the scene with eyes trained by 12 years of combat medicine. The helicopter had crashed during what appeared to be a routine training flight, but the injuries were severe enough to require immediate surgical intervention. The most seriously wounded was a man in his 50s wearing the uniform of an army general, multiple trauma, significant blood loss, and internal injuries that would be fatal without immediate surgery. "Sheriff, I need you to help me move the critical patient to the clinic immediately. The ambulance won't arrive in time." "Doc, shouldn't we wait for the trauma team from Billings?" Elena looked at the general's vital signs and calculated blood loss rates with precision learned from 800 previous emergencies. "He'll be dead before they arrive. We need to move now." 20 minutes later, Elena was preparing for surgery in her small rural clinic while county deputies assisted with equipment, and the 2 less seriously injured soldiers provided medical history for their commanding officer. What should have been a routine medical emergency was about to become a demonstration of military trauma surgery techniques that weren't taught in civilian medical schools. "Doc, his blood pressure is dropping fast," Deputy Johnson reported, monitoring vital signs while Elena scrubbed for surgery.
Copy that.
We're going to need to work quickly. Elena opened her locked supply cabinet and retrieved surgical instruments that her patients had never seen, military-grade trauma surgery tools designed for battlefield conditions. She had kept them for emergencies she hoped would never come, but tonight they were the difference between life and death for a patient who needed combat surgical techniques to survive. The surgery lasted 4 hours and required every skill Elena had learned during 12 years of battlefield medicine. She performed an emergency thoracotomy, repaired multiple internal injuries, and used field transfusion techniques with blood donations from the 2 conscious soldiers who insisted on helping save their commanding officer. At 4:17 a.m., General Patricia Hayes was stable and expected to make a full recovery from injuries that would have been fatal without immediate expert surgical intervention. As Elena cleaned her instruments, one of the assisting soldiers, a young medic named Corporal Thompson, approached with obvious confusion. "Doc, that surgery. Those techniques aren't taught in civilian medical schools. Where did you learn battlefield trauma procedures?" Elena looked through the clinic window at the sunrise over Montana rangeland, the peaceful landscape that had been her home for 15 years. "Corporal, some skills you never forget, even when you hope you'll never need them again. Ma'am, with respect, you just performed combat surgery that I've only seen in forward operating bases. That wasn't civilian medicine." Elena removed her surgical gloves and walked to where General Hayes was recovering under careful monitoring. The woman who had been unconscious during surgery was now awake and alert, studying Elena with the sharp assessment of a career military officer. "Doctor, I owe you my life. My soldiers tell me you performed surgery that saved me when civilian facilities shouldn't have been equipped for my injuries." "General, I did what was necessary with the equipment available." "Doctor, what they're telling me is that you performed trauma surgery using techniques and procedures that require specialized military medical training. Where did you serve?" Elena had spent 15 years avoiding this conversation, but her skills had been recognized by people qualified to identify them. Afghanistan, 2003 to 2015. Forward operating bases in Helmand and Kandahar provinces. General Hayes studied Elena with new understanding. "Major Elena Vasquez. I know your reputation. You were the trauma surgeon who saved more lives than anyone in the theater. Your techniques are still being taught at Army medical schools." "That was a long time ago, General." "Doctor, what brought you to rural Montana?" Elena looked around her small clinic, where she had spent 15 years treating broken bones and delivering babies instead of patching up soldiers torn apart by war. "I wanted to use my medical training to help families live normal lives, not to repair the damage from people trying to kill each other." General Hayes nodded slowly. "I understand. But tonight you used those same skills to save my life. Have you considered that rural medicine and combat medicine might not be as different as you think?" The next day brought federal investigators, military medical personnel, and reporters to the small town of Cedar Falls. The story of a rural doctor who had performed life-saving surgery on a crashed general spread quickly through military and medical communities, but Elena refused all interview requests and tried to return to her normal practice routine. General Hayes, recovering in the larger hospital in Billings where she had been transferred for continued care, sent Elena an official letter of commendation and an offer that would change her carefully constructed civilian life. "Dr. Vasquez, the military medical community needs instructors who can teach the trauma surgery techniques you developed in combat. Would you consider a consulting position training the next generation of combat surgeons while maintaining your rural practice?" Elena considered the offer while reviewing appointment schedules for patients who needed routine care, diabetes management, prenatal checkups, and school physicals that represented the peaceful medical practice she had built. But she also thought about young military medics who might face the same impossible surgeries she had performed for 12 years. "General, I'll consult on combat trauma training and technique development. But I want to keep serving this community. They need a doctor who understands that healing works both ways, helping soldiers survive war and helping communities live in peace." 6 months later, Dr. Elena Vasquez was still providing primary care to the residents of Cedar Falls, Montana, but now she also spent weekends at military medical facilities training surgeons in advanced trauma procedures developed during 12 years of battlefield medicine. Her rural clinic had been quietly upgraded with advanced surgical equipment that could handle complex trauma cases, and she had established protocols for emergency helicopter transport that reduced response times for critical patients throughout the region. Elena had learned that leaving combat medicine didn't mean abandoning the skills that could save lives. It meant finding ways to use those skills to serve both military and civilian communities without returning to the constant stress of wartime surgery. The doctor who had tried to forget the soldiers she couldn't save had become the teacher who ensured that future military surgeons could save more lives using techniques refined in the mountains of Afghanistan and perfected in the rural clinic of Cedar Falls. Sometimes the most important healing happens when former warriors find ways to use their expertise to preserve life in all its forms. Sometimes the best way to honor those who didn't make it home is to teach others how to bring more people safely back. Elena Vasquez had discovered that true medical service meant being ready to heal wherever healing was needed, whether in a combat zone or a rural clinic, and that the skills learned saving soldiers could be just as valuable in saving civilians. So now I ask you, have you ever known someone whose calm competence in routine situations suggested they had experience with much more demanding challenges? Someone who handled medical or emergency situations with a steadiness that seemed to come from deeper training. Share their story in the comments below. Tell us about the hidden medical experts in your life, the ones who bring specialized skills to ordinary healthcare and make everyone safer because of their presence. And if this story moved you, if it reminded you that healing often comes from those who have seen the worst of human experience, hit that subscribe button and join the Daily Story community. We're here to honor the medical professionals, the combat veterans, the people who dedicate their lives to preserving life in all its forms. Thank you for watching, and remember, the next time you visit a rural doctor or encounter a medical professional who seems unusually skilled, look a little closer. You might be meeting someone who has spent their career learning to save lives under the most difficult conditions imaginable.